Chapter 21 I am not Calabash Brothers, but please save my grandfather. You are listening at novelfull.audio. Xu Qiu. Opposite me, the director of obstetrics and gynecology finally couldn't help but speak. She praised him for a while first, then he directly explained the purpose and said, Xu Qiu, I think you don't seem to have any articles. In the emergency department, you are busy saving people every day and have no time to write articles. In this way, if you join our Department of Obstetrics and Gynecology in the future, I guarantee that you will publish 2 papers within a year. Point 1 of the 2 legs of a doctor is medical skills, and the other is scientific research papers. The Director of Obstetrics and Gynecology has indeed spent a lot of money. But, Xu Qiu finally shook his head and apologized, Director, I have no plans to transfer to another department yet. That's a shame, that the Director of Obstetrics and Gynecology did not force her to stay. She is not in a hurry. Residents have a 3-year rotation plan. During these 3 years, residents need to rotate in departments such as pediatrics, gynecology, obstetrics, infectious diseases, hand and foot surgery, etc. When Xu Qiu's rotation period in the emergency department ends, she will naturally go to other departments. There will always be a day when it is the obstetrics and gynecology department's turn to enjoy Xu Qiu. In the next few days, Xu Qiu continued to go about his daily routine in the emergency department. His consultation time was changed to the morning. After passing the assessment, Xu Qiu was truly qualified to treat patients independently. Clinic number 7 also officially changed into Dr. Xu Qiu's identity information. This means that Wang Ping, as well as the entire emergency department, recognize his strength. Except for the morning clinic, in the afternoon, Xu Qiu went to surgery. Basically do what you have. With his level of skill, any surgery that can be encountered in the emergency department is not a problem for him, unless there is a lung transplant for COPD, or a cranial separation surgery for conjoined twins. General surgeries are basically done at your fingertips. In just a few days, his impact factor has continued to increase. The rewards for signing in every day are becoming more and more generous. Master level C7 nerve root transposition on the unaffected side, Master's level transabdominal tissue forceps traction uterine reduction, Master level tibio-talar and heel fusion, etc., etc. At the same time, in the gynecology department, the recovery results of Luoyitong, a girl with ectopic pregnancy, also alarmed the doctors in the entire department. She had a catheter the night after surgery. The next day I had an appetite, started eating, drinking water, and walking. On the 3rd day, except for mild abdominal pain, there were no other symptoms. Another patient in the same hospital bed also underwent laparoscopic surgery 3 days earlier than Luoyitong. The patient is still taking pethidine for pain relief, often suffers from pneumoperitoneum, and has to deal with occasional bleeding and oozing. At this time, Luoyitong, who had completed the operation, was already qualified to be discharged from the hospital. This stark contrast made the bedmate collapse. It also caused a complaint to be made to the entire obstetrics and gynecology doctors and nurses. At this time, the director of obstetrics and gynecology realized the seriousness of the matter. She originally thought Xu Qiu was just fast. The doctors in the emergency department were not happy and were stabbed by the patient's son, but now, she finally realized. Not only was Xu Qiu fast, the results of the surgery and the prognosis were perfect. Li Shui, communicate with the emergency department and ask Xu Qiu to give us a lesson. The director of obstetrics and gynecology couldn't sit still at all. I still underestimated this young doctor. At this moment, the emergency physician's office, a familiar scene happened again. Luoyitong, who had been discharged from the hospital, stood at the door with a girlish blush on her face. Wang Fan sat upright, flipping through the medical records on the table, pretending not to notice this scene. He actually had some expectations in his heart. When Luoyitong suffered from rupture and massive bleeding, there were no other doctors. It was Wang Fan who rescued Luoyitong and gave Xu Qiu and the obstetrics and gynecology department the opportunity to perform surgery. In love with reason, I should be able to get a few words of praise, right? While thinking this, Luoyitong had already walked in with light steps. She stopped at the edge of Xu Qiu. Dr. Su, I'm going to be discharged from the hospital. Xu Qiu didn't even look back and said, yeah. You don't you have anything to tell me? Luo Yitong hooked his 2 fingers so hard that he almost bit his lips. In the office, the doctors all pricked up their ears. Xu Qiu still had a calm expression and said, I wish you a speedy recovery. Luo Yitong said aggrievedly, that's all. Dr. Su, do you know that I was bleeding heavily at that time? Wang Fan became energetic, finally want to praise yourself. Luo Yitong continued, at that time, I was in so much pain. In a daze, I felt someone pressing my chest, and it felt like my bones were about to be broken. At that time, all I could think about was you, thinking, I have to hold on until you perform surgery on me. Hearing this, Wang Fan looked helpless. Oh shit, I'm trying my best to save you, but there's another man in your mind. This is not a kind of NTR. A few days later, Xu Qiu received a banner. It was sent by Luo Yitong. A handsome face, wonderful hands, and rejuvenation. Although handsome face and the word rejuvenation are put together, it is easy to create bad associations. But Xu Qiu still accepted it. In the hospital, every banner represents performance and bonuses. This morning, Xu Qiu completed the sign-in again. Ding! Congratulations on signing in at Linhai First Hospital. Your impact factor is 4.6. Get a medium-sized bonus. The amount of bonus is 4.6. Ding! Congratulations on getting the master-level gastric perforation surgery package. Package content, perforation simple suture plus subtotal gastrectomy. At this time, Xu Qiu directly inherited the master-level experience of 2 surgeries. Although both are for gastric perforation, the 2 surgeries have different difficulties and indications. Just after receiving the reward, a young man rushed in panting. There was an old man with a painful expression on his back. Doctor, save my grandpa. The young man put the old man down, wiped the sweat from his face, and said anxiously. Xu Qiu immediately entered the state and glanced at the old man roughly. His brows were furrowed, cold sweat was on his forehead, and his expression was painful. The old man had dark skin and his face was not obvious, but his lips were already a little pale and he was breathing very hard. The most important sign, the old man has been hunched over and clenched his teeth. This manifestation, typical abdominal pain, inflammation of abdominal organs, organ perforation, acute and chronic cholecystitis, as well as constipation, tumors, heart disease, etc., which are common in the elderly, may cause abdominal pain. This requires further consultation. Xu Qiu asked, what's wrong with the old man? The young man said, 3 or 2 days ago, my grandfather suddenly had a stomachache. But he thought he could bear it, so he didn't come to the hospital. Now the pain is even worse. Xu Qiu asked, have you been to see a doctor? What medicine did you take? I took medicine. Some painkillers. I also took some stomach medicine. Xu Qiu asked a few more targeted questions, then took out the stethoscope and prepared to listen to the heart. Just as he was about to press the stethoscope on the old man, Xu Qiu's pupils suddenly shrank. He saw the patient's open palm. Chapter 22 Gastric Perforation in the Elderly, Discussion of Acute and Severe Cases. You are listening at novelfull.audio. The old man's palms had a lot of dandruff falling off, some were white, some were red, and there were a lot of dead skin that had not fallen off completely. Are there any on the feet? Xu Qiu asked immediately. The old man was very surprised and said breathlessly, oh, yes. You are really capable. Xu Qiu hurriedly said, old man, you don't have to talk. His face became a little serious. There are many diseases that cause peeling, like psoriasis, pityriasis rubra pilaris, pityriasis rosea, ichthyosis, etc. However, only the palms and soles of the feet peel off, which is a symptom common in toxic shock. And toxic shock, plus abdominal pain, the most common ones are bacterial peritonitis, intestinal paralysis and gastrointestinal perforation. Xu Qiu quickly listened to the patient's cardiopulmonary function. In addition to the common manifestations of hypertension in the elderly, there are no basic changes in cardiopulmonary function. Auscultation of the abdomen, abdominal breathing sounds disappeared, and bowel sounds disappeared. He wanted to check further, but the old man couldn't stay in bed because of severe pain, so he had to give up. The pain is burning, severe abdominal pain, nausea and vomiting. The patient's temperature is also high, with fever. In addition, the possibility of toxic shock, gastric perforation. Xu Qiu immediately came up with the most reasonable diagnosis. He wrote a list of examinations and said, "Go for an abdominal plain film." This is a diagnosis for gastric perforation. In addition, blood routine, coagulation, liver function, and kidney function were also done. This is for toxic shock. "Okay, let's go now." That the young man wanted to carry his grandfather. Xu Qiu stopped him and pointed to the corner of the clinic and said, "There is a folding wheelchair there." "Okay. Thank you, doctor." That the grandfather and grandson felt warm in their hearts and sat in the wheelchair and left. Next. Xu Qiu's voice sounded again. More than 3 hours later, the grandfather and grandson came with a stack of examination reports. They stood outside the door and waited for all the patients to leave before knocking on the door and coming in. "Doctor, look." That the young man had more respect for Xu Qiu. All this was just because of a wheelchair. Xu Qiu nodded and quickly scanned the checklist. The plain film showed that the old man had free gas under his diaphragm, a complete gastric perforation. Other reports also indicated that the old man was infected. There were mild abnormalities in coagulation, liver function and kidney function. It is obvious that after gastric perforation, a large amount of gas and gastrointestinal fluid flowed into the abdominal cavity, causing bacterial peritonitis. If the operation is not performed as soon as possible, the condition will develop into shock, and the old man cannot withstand this ordeal. Xu Qiu put down the checklist and said solemnly, "Gastric perforation, prepare for hospitalization, and arrange surgery as soon as possible." "Listen to you." The grandfather and grandson had no doubts and quickly arranged for hospitalization. On the same day, the old man completed all the examinations that should be done before the operation in the inpatient department. Because the old man was older, the indicators of liver and kidney function, coagulation and other indicators were not optimistic. So the emergency department invited the gastroenterology department to consult. At about 3 o'clock, the two departments discussed the surgical method for this case. As the first doctor, Xu Qiu also participated in the discussion. A doctor said, "There are two methods that have been determined. One is to simply suture the perforation. The other is to remove the majority of the stomach." Everyone expresses their opinions and see which surgery is more suitable for personalized treatment of the patient. That the deputy director of the Department of Gastroenterology frowned and said, "For this case, I suggest directly removing the majority of the stomach." That he analyzed, the patient has many perforations. There is a perforation of about 1 centimeter in the gastric antrum and the forearm of the gastric pyloric canal. In addition, there is also an ulcer perforation in the ileum. If repair suture is performed, there are too many perforations to be treated. Moreover, selective vagotomy plus pyloroplasty must be performed. The surgical steps are too complicated and the patient cannot last that long. A doctor agreed with this view and said, "The patient is old, 78 years old. At this age, just remove the majority of the stomach. Suturing is suitable for people with a longer survival period. The old man is old. To put it bluntly, he will not live for a few years. It is very good to correct the peritonitis caused by the perforation. It is obviously more practical to remove the majority of the stomach." Just as everyone nodded in support, Xu Qiu's voice suddenly rang out. He said calmly, "It is not a bad idea to simply suture the perforation." Everyone looked over. The deputy director of the Department of Digestive Surgery became interested when he saw Xu Qiu, and said, "Tell me what you think." Xu Qiu said, "The patient's physical condition is not as bad as everyone thinks. When I examined him, I found that he just had a little high blood pressure. Apart from that, he was in good health. His various abnormal indicators were basically caused by bacterial peritonitis. If the majority of the stomach is removed, his quality of life will plummet in the future. This is unacceptable for the patient, therefore, I recommend simply suturing the perforation." This view made many people frown. A doctor said, "It is too difficult to repair and suture. There are 7 or 8 perforations in the image alone. Unless the operation can be completed within 40 minutes, everyone's eyes were cast on the deputy chief physician at the same time. The deputy director shook his head, "It's difficult. If the abdominal cavity is opened, the situation will only be more complicated. There may be many small perforations that cannot be photographed. For such elderly patients, doctors tend to prefer conservative surgery. The risk is too high, and the threat to career is even higher. However, Xu Qiu took over everything at this time and said, "Leave this operation to me." The faces of the digestive surgeons present suddenly became strange. The emergency department asked them to come for consultation. Isn't it because they can't solve it here and can only ask for help from specialists? Their deputy director who specializes in digestive system diseases can't do it. Xu Qiu can do it. I know you are very good at orthopedics and minimally invasive intervention, but digestive surgery is different from other departments. How about this? I will go to the operating table and you will learn from me. The deputy director of digestive surgery said. Okay. Agreed. After the discussion, the deputy director and Xu Qiu went to talk to the patient. When Xu Qiu introduced, the young man kept nodding without saying a word. Finally, the deputy director added, "Make adjustments as soon as possible. When you are ready, I can start the operation right away." The young man suddenly looked up and asked in confusion, "Isn't it Dr. Xu who will do the operation?" The deputy director felt a little unhappy and said, "I am the deputy director of the Department of Digestive Surgery. I have performed at least 100 operations of this kind. You don't have to worry." The young man ignored it. He turned on his mobile phone and looked at the news on the public account of Linhai First Hospital. The surgeon who performed the operation on himself, Xu Qiu. Young doctor mastered the difficult bone reconstruction operation. Xu Qiu of the emergency department has achieved another success, conquered laparoscopic surgery in 37 minutes. Thinking of the wheelchair that represents care, the young man's heart suddenly warmed. He thought about it and said in a firm tone, "Can Dr. Xu do the operation?" Chapter 23. My hook is based on 20 years of surgical experience. You are listening at novelfull.audio. Can Dr. Xu do the surgery? Hearing this, the deputy director almost thought there was something wrong with his ears. This was the first time he was disliked, and the one who stole his surgery was just a small resident in the emergency department. But, since the patient didn't recognize him, he wouldn't do it shamelessly. Okay, if you want Dr. Xu to do the surgery, then let him do it. The deputy director waved his hand and said simply, anyway, he would also participate in the surgery. When Xu Qiu got into trouble, it wouldn't be too late for him to save the situation. That night, the news that the patient disliked the deputy director and asked Xu Qiu to do the surgery spread throughout the hospital. Everyone was shocked. It's Dr. Xu. Even the deputy director is outdone. We are both residents, and we are still struggling to write medical records, but Dr. Xu is now the lead surgeon. Don't even mention being the lead surgeon. I don't even have the qualifications to be the lead surgeon. I was scolded by teacher Wang Fan yesterday and cried. How did he scold you? He called me a killer and asked why the hospital paid me. I am a professional killer. Ha ha ha. No more, I'm going to write medical records. I hope the nurse can reward me with an operation tomorrow, or I can just do a hook for the patient. That night, countless residents felt the gap between people, and they may still have several years to go before they can be the lead surgeon. The next day, at 9 a.m, the digestive surgery meeting room. The patient surgical plan discussion will be held here. At 9:15, Xu Qiu rushed from the emergency department. When he walked into the meeting room, all the doctors looked over. Xu Qiu, the star doctor in the emergency department. I've heard of you for a long time. He cut his own appendix and injected lidocaine to suppress the pain just to save people. There are also subsequent bone reconstruction, laparoscopic surgery, etc. Xu Qiu's deeds have long been spread throughout the hospital. Even in the province, he has a considerable reputation. It is said that Lin Xia, the top orthopedic expert in China, and many hospitals outside have offered high salaries to poach Xu Qiu. Even within Linhai First Hospital, all departments are eyeing Xu Qiu. Now, they finally see him in person. Everyone has only one thought in their mind: so young, so handsome. With this appearance, it is the configuration of the male lead in a medical drama at first glance. No wonder the patient asked Xu Qiu to perform the operation. Ahem, let's start the plan discussion. The deputy director knocked on the table and pulled everyone back to their thoughts. Xu Qiu also quickly found a seat to sit down. Since he was the main surgeon, the plan for this operation was also designed by Xu Qiu. All kinds of examinations of the patient were listed, previous blood routine, liver and kidney function, etc. Yesterday, I also had a gastroscopy and a breathing test, and found Helicobacter pylori infection. This means that special attention should be paid to the use of antibiotics during the operation. After the operation, at least 2 weeks of quadruple drug treatment should be maintained. In addition, the CT and enhancement after admission found that the old man still had intestinal obstruction, etc. 20 minutes later, a detailed surgical plan was released. The operation probably includes laparotomy exploration plus intestinal obstruction decompression plus perforation repair and suture plus pyloric duct repair. The most critical difficulty is, the patient's abdominal cavity is in a bad condition, the number of perforations is large and hidden, and the whole body signs also show a toxic reaction of diffuse peritonitis. This means that this tedious operation must be completed within 40 minutes. Prepare for the operation. Xu Qiu seemed to have no worries at all, and he spoke calmly and arranged it. At 11 o'clock in the afternoon, everything was ready. The operation record was printed out. Preoperative diagnosis, gastric perforation, diffuse peritonitis, operation name, anesthesia, general anesthesia with endotracheal intubation, operators. Xu Qiu, the chief surgeon. Assistant, deputy director of digestive surgery. The deputy director assists the resident doctor. If an outsider sees this configuration, he will probably be shocked. However, at this moment, everyone in the operating room was really shocked. Beside the operating table, including the deputy director, everyone stared and watched Xu Qiu's performance in amazement. The midline incision in the upper abdomen was cut into the abdomen layer by layer, a near-perfect exploration technique. In the blink of an eye, a total of 11 perforations were found and marked one by one. The deputy director's face was full of horror. He didn't understand how the other party did it. Xu Qiu's abdominal exploration, how could he be so skilled? In addition, there were several perforation points hidden under the necrotic tissue, which even he might have overlooked. But Xu Qiu actually locked them directly. A normal doctor would need about 10 minutes to explore, but Xu Qiu completed it in 1 minute. In the second minute, he had already picked up the suture needle. Then, he first sewed 3 stitches on the number 7 line along the longitudinal axis at the perforation. Then, he pulled the adjacent section of the greater omentum, tied a knot after the suture to seal the ulcer perforation. All this happened too fast. In the blink of an eye, a perforation was perfectly repaired. If you don't look closely, you won't even notice that it has just been sutured. How can it be so fast? The deputy director was shocked. The reactions of the others were not much better. At this moment, the deputy director completely put down the airs of a senior doctor. He took the initiative to pull the hook to provide Xu Qiu with a clearer surgical field. Is this okay? Here, sutures. Is it not blocking you? Xu Qiu showed a satisfied look. He is indeed the deputy director. He is much more comfortable as an assistant than the attending Dr. Wang Fan. On the other side, the deputy director also laughed proudly. What a joke. He is the deputy director. Is Wang Fan able to cheat him? Hook and pull, there are more than 20 years of clinical experience behind it. In the 25th minute, all perforations were repaired. Selective vagotomy and pyloroplasty were also completed. Stop bleeding. The subsequent operations were somewhat mediocre. The surgical field completely stopped bleeding. Pelvic drainage tube was placed. Finally, close the abdomen. Before closing the abdomen, the instrument nurse shouted, "The number of instruments has been checked. There is no omission. You can close the abdomen." Xu Qiu then closed it layer by layer. The operation is over. The operation time is 28 minutes. After a short silence, someone finally came back to his senses and said in a daze. Done. Others also woke up from their shock. 28 minutes. Less than half an hour. Fuck. Dr. Xu is awesome. Too awesome, just like appreciating art. I can't describe my shock in words. The doctors in the digestive surgery department were completely convinced. Don't say that the patient chose Xu Qiu. If they get a gastric perforation, they have to find Xu Qiu. At this moment, Countless digestive surgeons had shining eyes, and their expressions were full of desire for technology. Deputy Director, we want to learn this too. The Deputy Director stood there, feeling at a loss. After holding it in for a long time, he uttered a few words. Chapter 24. I don't believe I'm worse than Xu Qiu. You are listening at novelfull.audio. I really want to learn too. It's not that he doesn't want to teach, but he himself may not be able to reach Xu Qiu's height. Soon after, the news that Xu Qiu had completed another difficult operation spread throughout the hospital. Have you seen the group news? Dr. Xu performed another difficult surgery. I heard that even the Deputy Director of the Department of Gastroenterology found it difficult. But Dr. Xu. How long did it take to get it done in half an hour? What a genius. He is only 24 years old, right? Oh my God, if I can master one of the surgeries that Dr. Xu knows, I can eat for the rest of my life. We came to the human world to make up the numbers. At this time, respiratory surgery, the newly recruited Ding Huan grimaced. He was the #1 overall scorer in the last recruitment. He graduated with a doctorate from Tiandi Union Medical College and holds several SCI papers in his hand. He is very capable in both scientific research and medical skills, but, after entering the hospital, as a resident doctor, he still had to start from scratch. Seeing Xu Qiu, who is younger than me, has only a bachelor's degree, and has no articles to his name, now he has become a star in the hospital. And he got rid of the tragic fate of being a resident doctor early and started to sit in clinics and perform surgeries. At this moment, Ding Huan felt a strong sense of jealousy in his heart. Just at this moment, another nurse passed by. He shouted, "Xiao Huan, send the plural of fusion specimens from the 7th bed for examination. By the way, Chief Shang also asked you to write out all those medical records and put them on his desk before leaving. Get off work at noon." After hearing these words, Ding Huan suddenly felt that everyone around him was humiliating him. His talent should not be buried here. So, he went directly to the director's office and asked for a chance to show his abilities. Is it because of Xu Qiu? The director saw the core of the problem at a glance. Ding Huan nodded and said unconvinced, "Why is he a shabby graduate? I don't believe it, I will be worse than him." The director leaned back in his chair, touching his chin, thoughtfully. After thinking about it for a long time, he decided to give Ding Huan a chance and said, "Okay, there happens to be a patient in the emergency department who needs a joint consultation with our respiratory department. How about you go with me?" "Thank you, Director, for the promotion." Ding Huan secretly clenched his fists. He will definitely seize this opportunity and soar into the sky. At noon, the emergency department took a short break. In the office, Wang Fan slouched up, glanced at Xu Qiu, and asked, "Would you like to go to the cafeteria to eat?" Xu Qiu touched his belly. He was indeed a little hungry. Just when he was about to agree, there was suddenly a burst of brisk footsteps outside. Dr. Xu. Lu Susu held a lunch box, poked her head and walked over. "I prepared lunch for you. The food in the hospital cafeteria is terrible. I made some food in the morning and I can't finish it. You can eat it too." She opened the lunch box. There is stir-fried yellow beef in it. There is also a portion of steaming braised pork ribs. Wang Fan stared and kept swallowing. After a while, several more nurses came. "Dr. Xu, I'll give you a banana. This is the pear I just bought today. I have an extra one for you. I bought a tiramisu, it's delicious." After a while, Xu Qiu's table was piled with food, meals, fruits, and even desserts are provided. Everyone in the office looked over with envy in their eyes. Just being handsome and popular, the surgery turned out so well. How can these emergency doctors, who stay up late every day and are almost bald, survive? Wang Fan only felt that his soul had been hit twice as hard. At this time, Xu Qiu pushed one of the lunch boxes in front of Wang Fan. "Let's eat something together." Wang Fan immediately turned from sadness to joy. "Isn't this not good?" After a while, Wang Fan, "It's so delicious." At around 1 o'clock in the afternoon, Xu Qiu was still taking a nap in the hospital lounge when the sound of an ambulance suddenly came from the emergency department. He quickly got up and went to support. This emergency was another car accident. However, compared to the last car accident, this one was obviously much less serious. After working for more than an hour, all the wounded were dealt with. Just as Xu Qiu was about to return to the office, another noisy sound came from the emergency department hall. Among the people who came in were 2 policemen, followed by 2 others. A man looked arrogant and wore a big gold chain, the other one is skinny, as if he is rewarding himself every day. "Comrade doctor, please help look at this person." The policeman directly grabbed Xu Qiu, who was nearest. Xu Qiu simply took people directly to the observation room. "What's going on?" he asked. The policeman folded his arms and said, the 2 of them were playing basketball. As they were playing, they turned into kung fu basketball. Xu Qiu realized, is this a fight? The skinny man covered his head and said in pain, "Doctor, my head was hit hard several times by this SB, and now I'm very dizzy. Can you please stop being so talkative?" The policeman shouted, interrupting him. On the other side, Xu Qiu scanned the man's whole body. His face wasn't too bad, it was overwhelming, probably just a mild concussion. He asked, "How do you feel now?" The man was stunned for a while before he suddenly reacted, and then he said slowly, "Dizziness, nausea, want to vomit, pain everywhere, and I always feel a little blurry in front of my eyes." Xu Qiu frowned. This symptom doesn't look like a concussion. He suddenly reached out and pressed the man's arm. Muscle relaxation. This doesn't look like a sign of pain all over the body. The contradictory signs made Xu Qiu a little unsure. After all, the symptoms of the injured person fit the description of brain stem injury. If this is really the case, once the diagnosis is delayed, the patient will lose his life. Xu Qiu wrote a list and said, "Go for an emergency CT scan, go and come back quickly." After thanking the police, they took both parties to the examination. More than half an hour later, they found the office with the results. The examination report was handed to Xu Qiu. At this time, the skinny man's face looked worse than before. His eyes were blank, his lips were pale, and sweat kept coming out of his forehead. Occasionally, he vomited uncontrollably. Xu Qiu looked at the other person deeply. Then he looked at the CT film of the imaging department. The patient's brain CT film was a mess and had little reference value. At the bottom, there were several items in the diagnosis results of the imaging doctor. 1. Moderate concussion. 2. Brain stem damage. 3. This result is only responsible for the image sample and is for reference only. It is recommended to combine it with further clinical examination. The question mark means that the imaging department is not sure. At this time, the big brother wearing a gold chain no longer had the previous arrogance. He said in a panic, "Doctor, he can't really have brain stem damage, right? He hit me first, and I hit him back." Hearing this, Xu Qiu put down the film and felt a little dizzy. Chapter 25 Dark Human Nature, Strange Infected Patients. You are listening at novelfull.audio. The reason is that it is too contradictory. The man's description of his symptoms was accurate, however, the actual condition he displayed was not consistent with the symptoms he described. For example, that if every disease were compared to a ball of yarn, the damaged brainstem is a red ball of yarn, and mild concussions are green balls of yarn. When a doctor diagnoses a disease, he picks at the exposed wool and eventually traces it back to the ball itself. This is well judged. The red and green lines can be seen through at a glance, but the situation of this man is, it should be very simple, but the red and green are entangled together. It is very confusing. At this time, Xu Qiu suddenly thought of the changes in the patient's face before and after CT scan. He seemed to understand something and asked, "Comrade policeman, did he go to the toilet before checking?" The policeman was shocked. "How do you know that this test didn't say you should hold in your urine?" Hearing this, Xu Qiu's eyes flashed with helplessness. He understood it all. Xu Qiu leaned on the chair and did not expose it directly, but said, "It's nothing serious, just rest for a few days and it will be fine." Brother Jean Lien immediately breathed a sigh of relief. The skinny man was furious and said, "What a bastard doctor you are, my brain stem has been damaged. Can't you see the test results above?" Xu Qiu immediately asked, "What are the symptoms of brain stem damage?" "Needless to say, I have dizziness, nausea, vomiting, indirect blurred vision, and I will also suffer from indirect coma." Xu Qiu smiled. "You are quite professional. Are you a doctor?" The skinny man's expression changed. His momentum immediately weakened, and he said, I I'm very dizzy now, and I've vomited several times. Xu Qiu, I walked around in the toilet a lot and even scratched my throat. Can I not faint or vomit? The policeman's face immediately became serious. Xu Qiu returned the checklist to the man and said, I read some tricks on the internet to extort money. Have you actually used them? The man's face immediately turned pale. He waved his hands and said, forget it, let's settle this matter. Let me go. At this time, 2 policemen held him up instead. Blackmail is already another sentencing standard. Brother Genlian held Xu Qiu's hand gratefully and said, brother, you are so perceptive. I almost went bankrupt. In the future, my brother and I will come to you if we are injured. Xu Qiu waved his hand. When he noticed that the other person's muscles were relaxed, he already suspected that the other person was pretending to be sick. However, many times, doctors are more willing to believe in patients, even though human nature is sometimes not so bright. After going to work in the afternoon, the emergency department became busy again. At 3 o'clock, a joint consultation between the emergency department, imaging department and respiratory surgery was held. Xu Qiu was also taken to see the world as he high's follower. This patient is a bit complicated. The outside hospital diagnosed him with suspected lung cancer, lung abscess, and infection. But the infection has not been identified with any bacteria. Follow me and learn more. He high said with his hands behind his back. Xu Qiu nodded and followed him into the conference room. As soon as he entered the door, he felt several unfriendly glances. Most of them are young doctors from the respiratory surgery department. There is also a dazzling resident doctor among them. Xu Qiu whispered, can residents also participate? He high was also a little surprised. It's a bit strange. How did the resident doctor sneak in? In joint consultations, difficult cases are discussed. Anyone who is qualified to say a few words is at least a deputy director, but as soon as he thought of this, he high suddenly fell silent. Xu Qiu, have you forgotten that you are also a resident doctor? After everyone is seated, the joint consultation begins. An attending stood up and introduced the patient. Male, 63 years old, was admitted to the hospital the day before yesterday due to right-side chest pain for more than 10 days and cough and sputum for 2 days, past history of cerebral infarction for 7 years, physical examination and chest CT revealed right lung infection and right pleural effusion, out-of-hospital diagnosis of lung cancer and lung abscess. Treatment with cefazolin, levofloxacin, ambroxol, and terbutaline was used, but no significant improvement was seen. The enhanced CT scan performed at admission yesterday showed a cavity in the right lung, accompanied by flat air and fluid levels, indicating lung infection. The patient's cough and sputum worsened on the day of admission, and the sputum was difficult to cough up. Physical examination, auxiliary inspection. After the introduction, everyone quietly looked at the patient information on the table. What troubles everyone now is the type of infectious bacteria, fungi, or other microorganisms. At this time, Ding Huan, who had read the medical records early and was ready to speak, stood up and said confidently, everyone, I think it's Streptococcus constellation plus a variety of anaerobic bacteria infection. Change to a large dose of penicillin, combined with fentanyl azole should make things better. The director of respiratory surgery nodded, like. The patient has multiple bubble-like cavities instead of cavities, which means high tension. The peripheral wall is thick and smooth, with compressive atelectasis of the lung tissue, a fluid level within the lesion, and patchy exudation in the ipsilateral lung. These manifestations are more consistent with the results of a variety of bacterial infections. Xu Qiu also nodded, indeed, judging from the current performance, Ding Huan is right. Mixed infection of streptococci plus anaerobic bacteria should indeed be the first choice, but as soon as he nodded, he noticed that Ding Huan across from him looked a little arrogant. Xu Qiu is happy. Is this little resident doctor here to show off his power? Xu Qiu didn't care and ignored the hostility of the other party. Ding Huan was excited and said, before I came, I asked the laboratory department to do the pus properties, microbial culture, and drug sensitivity test. The results should be out now. He made a phone call and urged the laboratory department. A few minutes later, a female doctor from the laboratory department brought the list with an unhappy look on her face. Don't occupy emergency resources indiscriminately. If such a patient is expedited, will I have a break at noon? that she cursed angrily and slammed the door before leaving. Everyone in the conference room was embarrassed. He sighed, offending the doctor in the laboratory department. Really don't want to do it? I'm afraid that if Ding Huan wants to expedite it in the future, the examination will be put at the back. How is the list? Asked the director of respiratory surgery. He diagnosed this patient. He told Ding Huan to give the examination list and diagnosis results to the other party to show off. Naturally, he couldn't let the place be ruined by a doctor in the laboratory department. At this time, Xu Qiu silently shook his head. The words that the doctor in the laboratory said before leaving, "This kind of patient must be rushed," actually announced the ending. Sure enough, after reading the examination list, Ding Huan's face became extremely bad, and his voice was hoarse. Microbial culture, drug sensitivity, and the nature of drainage do not support streptococcal infection. At this moment, the expression of the director of respiratory surgery was also a bit ugly. Damn, this is his diagnosis. How could it be wrong? Xu Qiu, who was sitting not far away, was also curious. His first judgment was actually a mixed infection of streptococci plus anaerobic bacteria, but obviously, this diagnosis was rejected, so, he opened the patient's information again and read it carefully. Suddenly, Xu Qiu noticed something, and his eyes suddenly lit up. Chapter 26 Antibiotics are everywhere. Can the treatment be successful? You are listening at novelfull.audio. He noticed an unremarkable symptom in the physical examination column. The patient's gums are red and swollen, and mild periodontal pocket overflow and pus can be seen. Xu Qiu quickly reviewed the patient's entire medical record. At the same time, my mind is working rapidly. After a moment, a somewhat bizarre diagnosis came out. Trichomonas vaginalis. As soon as these words came out, it was like a bomb detonating on the calm lake. At the respiratory surgery department, all the doctors burst into laughter. Ding Huan was originally ashamed of his misdiagnosis. Hearing this, he burst out laughing and said, "Are you kidding me? This is a male patient in his 60s, Trichomonas vaginalis. This is a bacterial infection of the female vagina, urinary tract, etc. How can it get into the chest and lungs? Besides, this is a man. Even if you talk about Trichomonas penis, it's not that outrageous." Director Zhang of the respiratory surgery department stood up and said, "It should be a rare pathogenic bacteria, so we should just surround it with antibiotics." After that, he ended the consultation without caring about Xu Qiu's face. Soon after, the group arrived at the emergency department ward. Bed number 60 is the patient with a difficult lung infection. This is Director Zhang of the Department of Respiratory Surgery. He has been engaged in respiratory diseases for more than 30 years. He is very good at treating difficult bacterial infections. Someone introduced. A glimmer of light appeared in the eyes of the patient's family members, and they rushed to greet him. Director Zhang clasped his hands behind his back and said nothing. His eyes rested on the patient. The patient had been bedridden for several days. At this time, his complexion could not be worse. His lips were gray, his consciousness was blurred, and he looked like he was dying. The air is filled with the stench of phlegm. I have encountered similar patients before, but it happened after drilling and drainage surgery for cerebral hemorrhage. That time was also extremely dangerous. Finally, the antibiotic siege tactic was adopted, using a combination of 4 high-grade antibiotics to finally suppress the infection. However, that case remained unsolved from beginning to end. Now this one, although the causative bacteria cannot be found now, the top priority is to curb the progression of the disease first and then save the person. Xiao Ding, use quadruple antibiotics. At present, the director of respiratory surgery gave further plans. It's just a difficult infection. He doesn't need Xu Qiu to point his fingers. Besides, Trichomonas vaginalis. What an outrageous speculation that is. After the chief doctor's order was issued, the emergency department quickly gave high-dose, wide-coverage high-grade antibiotics. In the afternoon, the patient's condition improved, the high fever subsided, and my consciousness gradually recovered. The patient's family was overjoyed. He kept saying that he would send a banner to the director of respiratory surgery. When Xu Qiu saw that his condition was under control, he didn't think much about it. He just felt that he might have paid too much attention to a particular symptom. Just when everyone thought that this patient's treatment was over, That night, at around 11 o'clock in the night, the patient in bed number 60 suddenly began to foam at the mouth and twitched all over. The nurse was called over by the panicked family members. When she touched her body temperature, she found it was too hot to touch. It was estimated to be about 40 degrees Celsius. This is a very high fever. After receiving the news, the director of respiratory surgery rushed over in a hurry. Under his white coat he was still wearing pajamas. What's going on? Why did it relapse again? The director of respiratory surgery frowned deeply, feeling incomprehensible. But he couldn't say this. Among the people present, he was the most professional. If even he is helpless, the medical staff and family members may fall into despair. Therefore, he could only say calmly, use polymyxin, that this antibiotic is the last trump card in the Department of Infectious Diseases. It is also a last resort. Sure enough, after being given polymyxin, the patient's high fever subsided in the early morning. However, the good times did not last long. The polymyxin had not been suppressed for a day, and the patient began to have high fever again in the afternoon of the next day. At this time, the patient's consciousness was almost completely lost. His eyes were gray, his cheeks were thin, and the entire ward was filled with the smell of sputum, excrement, vomit, etc. Director Zhang felt like his head was going to explode when he saw this message. What kind of evil is this time? He suddenly felt a headache. After looking through the literature in academia for a long time, there was still no result. In desperation, Director Zhang made a phone call. Teacher, I encountered a case. On the other side of the phone was the old professor who taught him decades ago. Although he has been relegated to the second line now, he has considerable knowledge in lung infections. After Director Zhang recounted the case, the other end of the phone fell into deep thought. After the two communicated for half an hour, the old professor gave new diagnostic suggestions. Superbugs. This time the treatment plan has also been upgraded. Surrounded by antibiotics plus albumin plus globulin, it comprehensively covers pathogenic bacteria and effectively activates the body's passive immunity. But when the new treatment plan was notified to the family members are despairing and have lost their last hope. How much does this treatment cost? The family member asked coldly. Sitting by the bed, Ding Huan, who came to deliver the message, crossed his arms and said, "It's not expensive. A course of treatment only costs 1,000 yuan. $1,000, enough for my wife and I to live on for several months." The family members kept sighing. It was mixed with the patient's painful cough. Ding Huan frowned, stepped back a few steps, and said, "Are you sure it's incurable? The patient's condition is still very dangerous now. If it works this time, it should be solved once and for all. I don't have so much money to try again." Seeing that the other party was determined, Ding Huan had to give up and hurriedly left the ward. After closing the door of the ward, he sighed, "It's a pity that such a rare case. If you continue to try new treatments and try a few more courses, maybe you can publish another article. After all, this is a rare and difficult disease in the industry." At this time, Xu Qiu in the office also received a call from He Hai. He Hai informed him that the patient with repeated lung infection in bed 60 suddenly asked to be discharged. Xu Qiu quickly retrieved the patient's record. He took a look and was shocked. The infection of this patient was not under control. His condition has been recurring, and each recurrence is more serious. Moreover, just half an hour ago, the respiratory surgery department opened a new plan. The cost of treatment is higher than before. Are you testing drugs on people? Xu Qiu rushed to the ward. Auntie, are you going to be discharged? Xu Qiu glanced at the patient on the bed, who was already dying. His expression immediately became serious. If the patient was really discharged, it was unknown whether he could survive for 3 days. Chapter 27. Arrogant prejudice almost killed this patient. You are listening at novelfull.audio. Xu Qiu knew very well that what troubled the other party was actually just one word, money. He knew that no matter how he tried to persuade her, it would be useless, so he simply said, "Mom, can we give you the last treatment before leaving the hospital for free?" At first, the family members felt like they were facing an enemy. When she heard that no money was required, her expression softened a lot and she nodded numbly. Xu Qiu quickly contacted the laboratory department and asked someone to come directly to the ward to take samples. 5 minutes later, the female doctor from the laboratory department came. "Dr. Su, this patient, are you sure he needs to undergo a gel aggregation test? The female doctor asked again. The gel aggregation method is a rapid test for detecting trichomonas in women's vaginal secretions. What is this man checking? Xu Qiu said, excuse me, please make sure this is the test. Good, the female doctor nodded and quickly completed the test. 20 minutes later, the test results were displayed on the spot. The female doctor's expression was dull, and she said in shock, Dr. Xu, 3 plus signs, plus, strong positive. Xu Qiu's tense nerves completely relaxed at this moment. He turned to his family and said, Auntie, I won't go wrong this time. Before he finished speaking, his family members slammed the table angrily and said, You use these words every time to defraud us of our money. I will never believe you again. Xu Qiu's face froze, turning his head and seeing the tortured patient on the hospital bed. He couldn't bear it, so he said, the total cost of this treatment should be between 300 and 500 yuan. I will pay for it. If the treatment is ineffective, the treatment will be free, okay? Here. The family members looked a little embarrassed. She didn't expect that the other party would deal with her anger in this way. But in the end, she accepted Xu Qiu's suggestion. An hour later, the treatment plans for all 60 patients were overturned and rewritten. With the new doctor's orders, a brand new name appeared. Xu Qiu, mainly metronidazole. Considering drug resistance, Xu Qiu also prescribed a pair of traditional Chinese medicines, including 10 grams each of agrimony, Sephora flavescens, Changshan, Leiban, Xanthoxylum bungianum, Shijunzi, Pulsatilla, Philodendron, betel nut, Artemisia annua and Nidium, made into a decoction. Of course, he is not qualified to prescribe traditional Chinese medicine at this stage. It was only through He Hai's name that he could issue this medical order. That night, the patient's high fever subsided again. The patient and his family members are very anxious, fearing that the disease will relapse again in the early morning. However, after one night, not only did the patient not have an attack, but some of the swelling on his body also disappeared. The next day, day 3. Things are getting better. By the 5th day, the phlegm was almost gone, there were only a few coughs, and the color of the face gradually turned red, and this time. Over at the respiratory surgery department, Director Zhang suddenly remembered this patient and mentioned it. Ding Huan checked the other party's medical records and said, Director Zhang, that person should have been discharged from the hospital long ago. But midway through his words, his expression suddenly changed. What's going on? Director Zhang frowned. He came over and took a look, and his expression was full of disbelief the next moment. Step aside. Director Zhang squeezed Ding Huan away and scrolled a mouse to check. 60 beds have not been discharged. Not only was he not discharged from the hospital, his teacher's original diagnosis and treatment were also crossed out and replaced with a new plan. And just after changing the plan, the patient's condition gradually improved. The imaging examination showed that the other party's infection had been controlled, with only some old lesions remaining. Director Zhang quickly looked at the doctor who prescribed the new plan. Xu Qiu, new diagnosis. Trichomonas vaginalis infection. Director Zhang only felt magical. He swallowed, thought carefully, and dialed the old professor's phone number. After describing the follow-up for this patient, the old professor was amazed and said, How can a resident doctor in your hospital be so thoughtful? Director Zhang swallowed and said, Teacher, that doctor can't use the common sense of a resident doctor to judge. You can't overestimate him just because he has a rare infection. Xiao Zhang, I taught you that you should always be down to earth when dealing with others. Teacher, I know. But he had a bone reconstruction, and even the experts from the Forestry Association were helpless during that surgery. The old professor almost broke his voice. You call this a resident? After hanging up the phone, Director Zhang took a deep breath. He said earnestly and sincerely, Xiao Ding, don't be too ambitious in the future, just be your resident doctor. At this moment, Ding Huan was speechless. The other party had already discovered the real cause of the disease a week ago, but I, and even the entire respiratory surgery department, are arrogant and prejudiced. Now it seems that I am simply ridiculous. Soon after, 60 patients were discharged. The family members paid back the treatment fee to Xu Qiu and included a red envelope of 100 yuan. This is a huge thank you to this struggling family. Xu Qiu did not accept the red envelope. After getting back the advance payment, he sent them away. After the patient was discharged, this case quickly became a typical case in the emergency department and respiratory department. For a time, the news spread throughout the hospital. After all, the presence of trichomonas in pleural effusion is even rarer than abdominal surgery to remove an eel. 61 years old. I'm going to die laughing. I guess she used her mouth. The woman may have had trichomonas vaginitis, and then she choked. Otherwise, could that thing get into the trachea? The god choked a bit, ahahaha. This is really a new experience. Trichomonas may have entered the respiratory tract through the patient's mouth or hands, causing obstructive necrosis on the bronchial wall, and finally entered the lung tissue. I can't help but wonder about Dr. Xu's mental state when he made this diagnosis. Who would have thought that in addition to reproductive system symptoms, trichomonas infection may also cause periodontitis, gingivitis, and dental caries? Dr. Xu's professional ability is so strong. The Hanged Man. Awesome, that a collection of department suggestions is being collected in a few days. Almost all respiratory surgeons voted for one option. The option content is ask Dr. Xu Qiu from the emergency department to conduct a teaching lecture/teaching surgery. At the same time, shortly after the patient was discharged from the hospital, a voice sounded in Xu Qiu's mind. Ding! Congratulations on completing the diagnosis and treatment of a difficult case. Difficulty rating, B. Diagnosis and treatment rating, C level. Get experience points *10. Current experience value, 100 out of 100, you get a chance to draw a lottery. Xu Qiu was pleasantly surprised, turn out to be, not only for surgery, but also for diagnosing difficult diseases. You can also get experience points as rewards after the patient recovers and is discharged. He quickly conducted the lottery. Ding! Get your reward, master flap transplantation. After receiving the reward, Xu Qiu started another day of daily work. In the past few days, there hasn't been much turmoil in the department. Occasionally there is a car accident. Or meet a kid who swallowed a light bulb. A few hours later, the child's father also came over swallowing a light bulb. A few more hours passed. An even more devastating scene appeared. Chapter 28. Dr. Xu, you are truly amazing. You are listening at novelfull.audio. Under the nurse's amused gazes, the taxi driver also came to see the doctor swallowing a light bulb. In the clinic, after experiencing 3 light bulb patients in one day, Xu Qiu couldn't help laughing. This disease is not an infectious disease, but it is worse than an infectious disease. That night, it was finally Xu Qiu's turn to be on duty. The first half of the night was very quiet. The nurses and doctors were a little drowsy. At 3 o'clock in the morning, the urgent sirens of ambulances cut through the night sky. The people in the emergency department immediately perked up and were ready. Soon after, 2 ambulances arrived, and 4 or 5 burnt and dying wounded were transported down from above. Quickly transferred to the emergency room. Xu Qiu dealt with the patients in his hands, and when he arrived, the emergency room was already crowded. Outside was a group of anxious family members, making a lot of noise. Some people cried, some people pounded the wall in regret, some people cursed angrily. If there hadn't been someone holding him back, the middle-aged man in a suit opposite would have been beaten into the emergency room. Xu Qiu walked through the noisy crowd with a cold face. When he saw the scene in the emergency room, he still shuddered subconsciously. There were streaks of blood on the floor of the emergency room. There was still a lot of skin tissue attached to it, and even melted yellow fat or blood vessels could be vaguely seen. In the emergency room, there were 4 or 5 burned people whose skin and sheets were melted together on the beds. Several monitors in the emergency room were alarming frantically, indicating that the patient had lost his spontaneous breathing. Xu Qiu immediately said, "Why are you still standing there? Quick, press. Ventilate. Don't worry about anything else." Under the current situation, it is almost impossible to open up a venous channel. The only thing to do is to save the most dangerous cardiac arrest first. Dr. Xu, when the rescue doctor saw that it was Xu Qiu, confidence suddenly burst out in his tired eyes. He quickly followed the instructions and began to press regularly. Even if the patient's burned skin stuck to his gloves, he didn't care. "What's going on?" Xu Qiu was observing the situation in each emergency room and asked the head nurse. The head nurse was busy and exhausted. When she looked up and saw that it was Xu Qiu, she suddenly felt inexplicably relieved. She hurriedly explained, "An accident happened in a factory. The boss forced several employees to meet the deadline. As a result, someone fell asleep and operated improperly. The machine hit the high-voltage wire and all 5 people below were swept and fell unconscious on the spot. Electric shock. Dr. Su, what should we do next? A patient is dying. Lead the way." Xu Qiu followed to the number 4 emergency room. The person on the bed was horrible. The burn area of the whole body may have reached 40%. The most serious one was the right upper limb, more than half of which was destroyed. The right hand had turned purple and was on the verge of ischemia, hypoxia, and necrosis. The monitor kept ringing, announcing that this life was about to die. Xu Qiu took 2 steps to the bed, put on gloves, grabbed the prepared scalpel, and cut open the patient's right upper limb, kakaka. As the skin was cut, the gas and tissues that expanded inside made a bursting sound, which sounded very relaxing. This step was to reduce pressure and prevent ischemic necrosis of the right hand. However, just as Xu Qiu cut the skin, a thrilling scene happened. The doctor standing on the other side of the bed had his pupils shrink sharply, and hurriedly said, "Dr. Su, the blood vessels are all deflated." The intravenous indwelling needle in his hand was suspended in the air, and there was no place to insert the needle. The head nurse's face was also pale. For patients with such burns, many blood vessels have been melted, and those that can be found are almost impossible to insert the needle. Now the blood vessels are deflated, and it is even more impossible to open a venous channel. And this means, no matter what measures are taken, the patient will die quickly within a few hours. The reason is simple. In addition to septic shock, patients with severe burns also have an extremely serious complication, hemorrhagic shock. The massive blood loss led to insufficient blood volume and a sudden drop in blood pressure. If he was not given fluid through the intravenous channel in time, his chance of survival would be 0. Just when the rescue doctor was panicking, Xu Qiu's reassuring voice sounded. "I'll do it." He took the needle and searched for a usable blood vessel on the patient. Finally, he found a tricky part and pierced into the great saphenous vein. Swish, the next moment, he completed the opening of the intravenous channel. The nurse hurried to verify it, and after a moment she was ecstatic. Success. It succeeded in one go. The head nurse widened her eyes in shock. Dr. Su is really amazing. His medical skills are even more perverted than the rumors. After solving this episode, Xu Qiu continued to expand the wound and clean it. Necrotic tissue, rotten flesh, and half-dead fascia, nerves and blood vessels must all be cleaned up. Because he mastered the master-level cleaning technique, he cleaned the wound very quickly and with terrifying efficiency. Even the deep necrotic muscles were pulled out. The expressions of the people present were stunned. Is this really just debridement? Such a basic operation can be done so perfectly. At this time, Xu Qiu quickly observed the color of the patient's lips and nail bed. "It's not good," he shouted in a deep voice. "Increase the oxygen flow, 5 L per minute. Quickly replenish fluids, tenfold fluid replacement. Decompression of burn site, jumping cleaning, vascular dredging, and so on." Finally, after 5 minutes of rescue, the patient's heart rate gradually recovered. "Contact ICU and send him there quickly." Xu Qiu took off his gloves and wiped the sweat off his face. The patient's condition was too serious. Saving him now was only temporary. He needed close care from the ICU. Maybe we have to use extracorporeal membrane oxygenation. Xu Qiu judged, that is, ECMO, machine that replaces the human heart and lungs. Even if the patient's heart and lung function is almost lost, as long as there is money, he can rely on an extracorporeal oxygenator to keep him alive. "Dr. Su, thank you for your hard work. Leave it to us next." The head nurse, rescue doctors, and others bowed to Xu Qiu. Tonight, if it weren't for Xu Qiu, many people might have died in the emergency department. The next day, when Xu Qiu went to work, he also received a thank you letter from the head nurse. Lu Susu yawned and said, "The head nurse actually wrote you a thank you letter. She's so fierce." Xu Qiu smiled, put away the thank you letter, and returned to the office. At noon, Xu Qiu wanted to ask about the patient sent to the ICU. At this time, Wang Ping came over first. Director Wang. Xu Qiu stood up and greeted him. I heard about what happened last night. You did a great job. Wang Ping showed an admiring look. Xu Qiu nodded modestly. The other 4 are now out of danger. One had an amputation and his life is not in danger. The problem now is which patient was sent to the ICU. Wang Ping found a seat and sat down and started chatting. Hearing this, Xu Qiu's heart sank. This patient was rescued by him. Is there something wrong? Chapter 29 Characters in the Textbook, Professor Meng. You are listening at novelfull.audio. Xu Qiu asked, can't I be saved? Wang Ping shook his head. You did a great job in rescuing him. He has no major infection, the problem is himself. If his infection was a little more severe, or the necrosis was a little more, he had no choice but to have his leg amputated, but now, he wants to keep his right hand. Xu Qiu understood, if he hadn't taken action last night, the patient would have had no choice but to amputate his limbs to save his life, but because his rescue was so perfect, he had a chance to save his hand. However, the cost of limb preservation is very high. Really, Wang Ping was worried and continued, he really wanted to save his limb, but limb salvage surgery is very difficult. First, he had to be equipped with an extracorporeal oxygenation device. There must be a doctor who can do this kind of surgery. You should be very aware of the difficulty of this operation. Not many in our burn department are confident about it. Moreover, his family members are very difficult to deal with. Once the operation fails, the doctor may have to deal with endless medical troubles. Although the moral character and character of family members are not things that doctors should consider when saving people, but doctors are human too. Many times, walking on thin ice and weighing every detail is the real working state of a doctor. Wang Ping let out a long sigh and said, first save life, then save limbs, then restore function, and finally improve appearance. This process is too painful and few people can persist. I went to persuade him first. Xu Qiu deeply agreed. Many patients desperately want to save their limbs before surgery. However, in the process of limb salvage, it may be because of pain, the cost may be too high, or the results may be unsatisfactory. Attitudes will undergo a 180-degree change. Many people give up midway. Xu Qiu had previously obtained a master's degree in skin flap transplantation. This limb salvage surgery for burn patients in the ICU corresponds to skin flap transplantation. Simply put, all the skin and tissue on his hands were burned away, like sausage, cut into pieces. The flap transplant surgery involves transplanting skin flaps from other places, that is to say, tear down the east wall and make up for the west wall. Through this method, the function and appearance of the patient's arm are restored as much as possible. Of course, it's very difficult. What's more difficult is the patient's state of mind after surgery and how strong his will is. Therefore, whether this operation can be carried out depends on the patient's wishes and how strong the desire to save the limb is. In the afternoon, as soon as she got to work, Xu Qiu dialed Director Wang's phone number directly. After explaining his purpose, Wang Ping was a little surprised and said, have you also studied burn surgery? I had an epiphany 2 days ago. You kid really likes to joke. However, this patient was sent to the nearby International Friendship Hospital. They happened to have a burn surgery expert who was performing surgery, and they agreed to do ours. How about you come with me to have his eyes opened? That's a top burn surgeon. Usually, you can only see characters in textbooks. Since Xu Qiu is also interested in burn surgery, taking him to observe it will be of great benefit to his future development. Thinking of this, Wang Ping flashed a smile and added, but please be calm. When I first saw this expert perform surgery, I was shocked. The surgery could actually do this. Don't be frightened then. Xu Qiu smiled knowingly. Soon after, he met Wang Ping, and the two rushed to the International Friendship Hospital. Have you interviewed at this hospital before? Wang Ping asked casually. Xu Qiu did not deny it. When he first traveled across time, most hospitals had submitted resumes. International friendly hospitals are naturally among them. However, based on his resume at the time, it was no surprise that he was dismissed. Wang Ping did not continue to ask further questions and said, speak less for a while, listen more and watch more. The star department of this hospital is the burn surgery department. In addition, this time we invited an expert from the burn department to perform knife throwing, which was an excellent learning opportunity. Linhai International Friendship Hospital, burn surgery conference room. An old man with a gray beard and deep eyes sat in the main seat. Xu Qiu looked at it for a long time and felt more and more familiar. Suddenly, he remembered Meng. In the latest edition of the textbook on burn first aid, one of the editors is him. Everyone is here, Mr. Meng, it's time to start. A director stood up and reminded. An hour later, the intense discussion of the plan ended. Next, it's time to wait for the surgery to begin. Xu Qiu left the conference room and stood in the corridor waiting. Suddenly, a person from behind patted Xu Qiu on the shoulder. Xu Qiu, a tall, thin doctor with thin hair said in surprise. Xu Qiu recognized the other party. When I was in college, the study committee member of my class was named Jiaolu. You guy, you can actually enter the conference room? Jiaolu was shocked when he saw Xu Qiu walking out of the conference room. Those who can participate in the meeting are at least senior directors. There are also many deputy directors and directors from other colleges. How did Xu Qiu, a resident doctor, get in? Jiaolu lowered his voice and said, will you also watch the operation later? I remind you that Mr. Meng has a bad temper. When the time comes, just stay in the corner with us. If you can't see it, don't watch it. Just hang out for a while. Xu Qiu nodded, thank you. Jiaolu waved his hand and said, it's okay. Anyway, we residents don't have much human rights. Let's help each other. Just to watch in the corner of the operating room, I have begged the director for a long time, alas. Xu Qiu, it's a bit miserable. Yeah, who let us be residents? Jiaolu hugged his arms and waited for the operation to start with Xu Qiu. Half an hour later. The operating room is ready. In the center, there are the operating table and the patient. Next to him is the chief surgeon Meng. Next to him are the first assistant, second assistant, third assistant, etc. of this operation. Outside here, there is a circle of attending physicians. In the corner of the operating room, Jiaolu and other residents are. After entering the operating room, Jiaolu looked out to find Xu Qiu. When he saw Xu Qiu standing next to the operating table, he was stunned. You said so miserable not out of sympathy, but out of sympathy for me. The operation begins, accompanied by the steady voice of Mr. Meng. This difficult flap transplant officially began. Mr. Meng is a traditional doctor of the older generation. He is extremely particular about details. Therefore, even though this patient had undergone debridement before, he still had to clean it again on the spot. However, as Mr. Meng checked the muscle necrosis in various places, the wrinkles on his face suddenly relaxed. Who of you did the debridement for this patient? Mr. Meng's tone was full of praise. Chapter 30. Is this a resident doctor? Do you want to let people live? You are listening at novelfull.audio. Mr. Meng turned his attention to the nearest director of burn surgery. The other party shook his head and said, Mr. Meng, the patient has been debrided before he was sent here. At this time, Wang Ping suppressed his surprise and seized the opportunity to say, it was done by a resident doctor in our hospital, this one, Xu Qiu. Everyone present showed incredible expressions. Resident. At the beginning, even the chief doctor for debridement was scolded by Mr. Meng. The debridement skills of a resident doctor were so impressive that Mr. Meng was impressed. At this moment, countless complicated eyes fell on Xu Qiu. In the corner, Jiaolu was also dumbfounded. Why is my old classmate, a resident doctor, treated differently from them? Good. On the operating table, Meng Yingan gave a rare compliment. You come to the front. Meng Yingan raised her chin, and the third assistant quickly gave up his position to Xu Qiu. The operation continues. The difficulty of this operation is still very high. If you want to preserve the shape of your right upper limb, it must be cut and transplanted from other places with skin flaps. Conventionally there are two alternative flap sites. One is the back, but the abdomen, because the patient is heavier, the abdominal fat tissue is more abundant. Using an abdominal skin flap will cause less harm to the patient, and the subsequent scar repair will be slightly faster. After weighing it, I finally chose the center of the upper abdomen, in the operating Room, time flies, 1 hour, 2 hours, 3 hours, everyone in the operating room was silent, staring at Mr. Meng's operation. From time to time someone exclaimed. What a flexible Z-shaped rotation method. This relative triangle scar contracture correction method is so skillful. Of course I'm proficient. This is a technique created by Mr. Meng. We have finally met the originator. Xu Qiu also nodded silently. I have to say that Mr. Meng's surgery was excellent, even if he has a master's degree in skin flap transplantation, he can't find too many shortcomings. However, at this moment, Mr. Meng seemed to notice Xu Qiu's gaze, and suddenly raised his head and asked, do you have a better opinion? At this moment, the atmosphere in the entire operating room dropped to freezing point. Everyone was frightened. Did this offend Mr. Meng? Wang Ping quickly smoothed things over and said, Mr. Meng, the child I brought does not mean any harm. Mr. Meng interrupted him and said, stop talking. Boy, you were frowning just now. What am I not doing well here? Under the horrified eyes of everyone, Xu Qiu nodded slowly. He said without being arrogant, the rotation position of the skin flap has shifted a bit. If we continue to suture, the wound will be under great tension. Meng Yingan frowned. He looked carefully, then carefully compared the removed skin flap with the area to be anastomotic. After a moment, he shook his head and said, I marked it before, and this angle is just right. Xu Qiu moved her hands. Meng Yingan paused for a moment, and then said, come here. Only then did Xu Qiu and her Suk change places back to back. He reached out and pressed the skin flap down slightly. Suddenly, the wounds that were originally closely aligned began to shift. Meng Yingan's eyes widened, and he immediately reacted, saying, it's the original deep fascia of the right upper limb. During suturing, it will be compressed and squeezed, causing the skin flap to shift. Xu Qiu nodded, yes. Material that can be made. Meng Yingan praised happily, and then said to Isuk, you also go away and what is your name? Xu Qiu. Let Xu Qiu be a helper. Meng Yingan ordered. Wang Ping stood on the outside with a shocked face and question marks on his head. Damn it. I was still watching from outside. Why did you run to Mr. Meng's side? He also squeezed out the director of his burn surgery department. At this moment, others were even more confused. Residency? Is this a resident doctor from Linhai No. 1 hospital? Let no one live anymore. When the operation reached the 5th hour, Meng Yingan's speed slowed down significantly. This is an objective law that even doctors cannot defeat. A person's knowledge and experience may become richer and richer, but energy and physical strength will only continue to decline. Many people believe that the older a doctor is, the more capable he will be. On a diagnostic level, that may be true, however. The peak of surgical ability must be around 40 years old, even for Meng Yingan himself. The peak period of surgery in his life was in his 40s. Now, at nearly 80 years old, he can still perform surgeries. However, compared to before, whether it is concentration, endurance, control of hands, etc., they have dropped a lot. This is something that many outsiders don't know. For surgery, it is best to choose a deputy director who is around 40 years old. These people have the best technology, the most energy, and the highest surgical success rate. But Mr. Meng was so powerful that even today, when his surgical skills have declined, he is still an unshakable mountain in the field of burn surgery. Change your glasses. Mr. Meng shouted. The instrument nurse quickly replaced him with a pair of concave lenses to see the distant surgical site. Change. The next moment, he changed the double convex lens to see the nearby transplant area. This is also the helplessness of getting older, presbyopia and myopia. As a result, he needs to constantly change glasses during the operation to see the surgical site clearly. 20 minutes later, Meng Yingan put down the stitches and closed his eyes to rest temporarily. His eyes were too dry, and the shadowless lamp shone for more than 5 hours, causing stinging in his eyes. The right hand arched in front of his chest was also shaking constantly. Meng Yingan sighed heavily. The difficulty of this operation was higher than he had overestimated. Usually, he can only perform one operation lasting more than 5 hours in 2 days. He had already performed one operation last night. This morning, another difficult patient was sent and that was not planned. it was a bit overwhelmed. Meng Yingan opened his eyes and glanced at Xu Qiu. Can this kid do it? As soon as this thought came up, Meng Yingan smiled self-deprecatingly. He was willing to take on this operation because no one else could do it except him. If he didn't take it, the patient would lose an arm. If a resident doctor could perform the operation, the deputy director and director of the burn surgery department present were probably living like dogs. Go on. After a short rest, Meng Yingan decided to continue to carry the banner, removing scars, measuring vascular pedicles, relaxing and cutting spasm bands. Slowly, Meng Yingan's expression became more and more surprised. He found that Xu Qiu had prepared the surgical field in advance without his prompting, and his movements were smooth and without any pause. This was not tacit cooperation, but the other party really had something in his mind. Could he really do a flap transplant? Just as Meng Yingan was guessing, the monitor suddenly began to emit a harsh alarm. At this moment, everyone's heart was lifted again. What happened? P.S. When I'm not busy in the hospital in a couple of days, I'll write more for you. There will be free reminders and small gifts. Please vote more. Thank you.